Well, Brad, thank you, and good afternoon. Well, we continue to stress that the best way for people to stay healthy and help stop the spread of COVID-19 is to stay home as much as possible. We know that people will still want to get out in the winter to get exercise and to keep healthy in that way. Dr. de Villa's advice has been clear that you can go to a park on your own or with the people that you live with right now. And that is why we have been working as a city to have an enhanced winter parks recreation plan. Much as the pandemic makes things different, we're committed to giving people more things to do outside safely through our Welcome TO winter plan, which I'm going to outline today. This winter, you can stay active with members of your own household or by yourself at 23 toboggan hills in neighborhoods across Toronto, 8 new snow loops for walking and snowshoeing at the city's 5 golf courses, with the loops ranging from 1 to 2.5 kilometers. All 54 of the city's outdoor ice rinks will begin opening for free leisure skating as early as this weekend, if the weather will allow it, with the maximum of 25 participants due to the provincial capacity limits. We have worked to extend the season at 13 rinks, so all of them will be open, again, weather permitting, for 16 weeks this year. Grenadier Pond will be open once again to skating with ice monitoring back during the pandemic in anticipation of increased demand for places to skate. An additional 60 kilometers of paved recreational trails and pathways will be maintained throughout the winter. That's on top of the work that we normally do. Approximately half of all parks have major pathways maintained in the winter as part of their regular services. There are approximately 100 high-use parks where we undertake major winter maintenance, and will be expanding maintenance at 60 of those parks, including parking lots and paved pathways, to enhance participation opportunities for Toronto residents. Trails and pathways maintained and recommended for use will be identified using signage and will be communicated to residents. As we announced earlier, we will more than double our supply of winter park washrooms from 64 to 143. Washrooms will also be available at city community centres and outdoor ice rinks across the city. Outdoor sports courts, including 57 tennis courts with nets in place for winter tennis, will remain open. And winter tennis is the same game as summer tennis, except that it can be played on certain days in the winter when it isn't that cold, and we will leave the nets up unusually for people who wish to take advantage of that. 6 disc golf locations, including the newest at Scarlet Woods Golf Course, will be open beginning November 28th. We will have new guided outdoor walk fit programs, including 45 sessions each week that residents can register for. And High Park will continue to be car-free on weekends, as it has been throughout the pandemic. We want to remind people as well of the fact that many of our parks' amenities will remain open. More than 800 playgrounds and 30 parks with outdoor fitness equipment will remain open through the winter. 70 outdoor table tennis and 60 chess tables will remain open. 68 dogs off-leash areas also open, and the archery range in the E.T. Seton Park remains open. We will also have 30 natural ice rinks up and running, weather cooperating, of course. The city is continuing to accept applications until December 31st for community-built and maintained natural ice rinks in city parks. Ice making for our artificial rinks began last night, and we hope that the weather will permit openings for as early as this Saturday. Staff are working through mechanical issues at 3 of the rinks, but we're planning to have all of our artificial rinks, even the Dufferin Grove rink, which was supposed to be closed for repairs, up and running for this winter. Due to the pandemic and resulting public health considerations, we are introducing a reservation system for the city's rinks. Reservations can be made on the city's website at toronto.ca. A number of spots will be reserved for people who are not able to make a reservation online, but we're really encouraging people to register online so that they know that they have a spot, and so that we can avoid any unnecessary crowding that would be contrary to our health advice during the winter season. The city has developed strategies over the course of the summer with the pools. Many of you will have experienced those strategies to help control crowds and manage appointments and things like this. Also, strategies with regard to the fencing off will be developed of some of these rinks that are open, just so that we can again manage the crowds in the interests of public health. Special consideration was given to the city's most popular destination rinks, such as the one here at City Hall at Nathan Phillips Square, in order to ensure that all rinks operate safely within public health guidelines. Parks workers will be on site at the city rinks to help with this management task and to help to provide advice to people. We did have a successful experience of this kind over the course of the summer at our city pools, and we hope to see the same expertise applied, but also the same patience and understanding from the public that we received at the swimming pools so that everybody can stay safe and stay healthy. The city is recommending that people wear masks or cloth face coverings both on and off the ice, and that includes while waiting in line. And again, we will ask for people's compliance and understanding in that regard. People should also make every effort to remain a distance of 6 feet away or 2 meters away from other people, both on and off the ice. And again, this will require, we'll have extra staff helping with this, but it will require extra cooperation. We know that childcare continues to be an essential service for Torontonians, so that I can reassure you that community centres remain open for after-school recreational care. Holiday Camp TO for children will continue as scheduled, and we have expanded it this year so that it will be available at 42 different locations. More information and registration can be found at toronto.ca/camps. I believe that with diligence on behalf of staff and members of the public, we can continue to offer safe recreation opportunities throughout the winter. We are committed to updating this plan as needed, and as the COVID situation, and for that matter possibly the weather, change, the city continues to work diligently and closely with Toronto Public Health on recreation programming and will be guided, of course, by their advice throughout. Decisions to resume service or offer new service will be made in consultation with Toronto's Medical Officer of Health, Dr. de Villa, and in accordance with prevailing rules put in place by the Province of Ontario, which of course can change and have changed from time to time. While we're in lockdown now, our economic development staff are working on plans for the new year to help encourage people to enjoy the winter and their neighborhood safely and in line with those public health rules. Those details are dependent upon the health situation, so we will have more details as the situation changes and hopefully improves. We've opened applications for the Show Love TO Community Partner Program and the Winter Activation Grants, and I might just spend a minute talking about those so that people who would like to apply will know what those programs are for. These grants will go to organizations which produce one-time safe community events in the new year so as to bring life back to our neighborhoods over what could be a very difficult winter in many other respects. Likewise, the City of Toronto's Winter Activation Grant aims to provide funding for the business improvement areas throughout the city so that those groups, plus community and not-for-profit organizations and charity groups, can help to animate our main streets across the city with winter activities. Again, safe, healthy winter activities. Winter has always been a traditionally slow time for retail, and of course in the aftermath of the present lockdown we're experiencing, we need to make sure that winter becomes a vibrant and dynamic time, health permitting, to make sure we can help those retailers get back on their feet and stay healthy. I know that BIAs and community organizations know their neighborhoods the best, which is why we designed these programs so that they could apply to organize and put on these events with some financial help from us. And they will come up with the innovative ways to help people stay active, to help support our small local businesses and restaurants, and also, of course, to stay healthy. We know this is an incredibly difficult time for many small independent businesses. I want to thank the vast majority of these businesses, especially restaurants, who are doing the right thing, following the provincial order, respecting the law, and shifting their businesses to takeout and delivery and curbside pickup to help stop the spread of COVID-19. Their compliance and their respect for the law is very deeply appreciated by all of us who are involved in government. I continue to urge businesses who remain open under the province's guidelines and residents to avoid in-person Black Friday sales. Both businesses should avoid holding them, and residents should avoid attending in-person Black Friday sales. I am suggesting that people should not patronize in-person Black Friday sales by big stores that are open. It is not worth the risk of contracting and spreading COVID-19. Frankly, I have said that I don't believe stores which are open for technical reasons should even be holding in-person Black Friday sales. Please shop online or use local curbside pickup with local, small, independent businesses. They need your business right now more than ever. Today is Wednesday, and if ever there was a better time to resume and make bigger and better what became known in the spring when we were in a similar circumstance as Takeout Wednesday, this is the time. I encourage people to order from their local restaurants for dinner tonight if they can. Every single order will help restaurateurs who have been hard-pressed for some time now. Go to toronto.com to find nearby restaurants that are open for takeout and delivery. I hope we might put a big citywide push on this for next week, because today is already Wednesday and many people will have made plans already. But I hope you can stay tuned. But don't wait. Don't wait. If you haven't made plans for tonight, do it tonight. Takeout or delivery are going to help these restaurants to stay in business, because it is that crucial for them at this point in time when, unfortunately, they've had to be closed as a result of the public health restrictions. We really need to get behind them and support them now, starting tonight and every night, but we'll try and put a big push on to have next Wednesday's Takeout Wednesday be bigger and better than ever for our restaurant friends. It's now time for Dr. de Villa to offer her remarks for today.
Thank you, Mayor Tory, and good afternoon, everyone. I want to start today with a stark indicator of COVID-19 in Toronto and the extent of the risk facing all of us. With the assistance of my colleagues here, there's a map you'll see on screen, and it shows the neighborhoods in Toronto that meet the provincial red zone criteria of greater than 40 cases per 100,000 people for the week of November the 8th. In Toronto, the 3 neighborhoods with the highest rates are at 514 cases per 100,000, 427 cases per 100,000, and 361 cases per 100,000 people. The fact is, rates are alarmingly high in Toronto. It is fair to assume the neighborhoods that aren't red could easily yet be, given the level for inclusion is 40 COVID-19 cases per 100,000 people. Today, I am reporting 481 new COVID-19 cases. There are 168 people in Toronto who are in hospital with COVID-19 and 39 people in intensive care units. These numbers show there's not much to debate over the need to limit contact between us. You are safest with the people you live with in your home. After that, at these levels of infection, the risk from other people begins to rise immediately. So, as much as possible, we must limit contact with people we don't live with, but we don't have to eliminate it. As you've just heard the mayor speak to, it's still possible to get out and be active and be safe. The winter plan provides a clear map for how to do that. We can definitely make the most of the outdoors this winter, and I encourage you to make plans to do just that. But planning is essential, because in these conditions, we have to consider our safety, which is not something we've ever really had to do before, and certainly not with the kind of urgency that's attached to it now. The question of safety cannot be ignored by any of us. COVID-19 isn't just a cold, and it's not the flu. It's 2020, and despite all the knowledge and all the science and all the technology that we have at our disposal, 1,555 people in Toronto are dead because of COVID-19, as are more than 1.4 million people all around the world. From a public health perspective, I believe a fully functioning economy is the best possible thing. But an economy simply cannot function fully in conditions like these. COVID-19 will spread wherever it can. The easier we make it, the worse it gets for people. The worse it gets for people, the harder the hit on the economy. I'm sorry COVID-19 ever emerged, and I am saddened by the damage it's doing. But it has emerged, and the truth is, right now, every person in Toronto is at risk from it. If you get it, you may be spreading it for days before you even know you've got it. You may never know you've got it and keep on spreading it. That's why, with infection rates so high, you've seen steps like the ones taken in the last days and weeks. If you get it, you can't know how will it affect you until it's too late to do anything, but wait to see what happens. And even if you are willing to take the risk for yourself, no one has the right to knowingly or negligently impose COVID-19 on anyone else. And those are the facts that I have for you today. I'll now turn it over to Brad so we can take some questions.
Thank you very much, Dr. de Villa. We have a number of staff on the line today. Should reporters have questions, including Chief Pegg, Staff Superintendent Mark Barkley from the Toronto Police Service, and Janie Romoff from Parks, Forestry and Recreation. We'll go first to Dave Bradley from News Talk 1010, and I'll remind all reporters to please unmute yourselves before you ask your question. Dave, go ahead.
Thanks very much. My question is for Mayor John Tory. We had a caller on one of our talk shows yesterday. There's a laid-off restaurant worker who said he was shaking mad at the inaction of the municipal government surrounding that whole barbecue protest. And he singled out you, Mayor Tory, for not taking leadership on this. So my question is, why aren't you there personally to try and diffuse the situation today?
You know, my experience has been as mayor that sometimes I will come to large crime scenes or large fires really just to show my support for the people, whether it's law enforcement or fire officials, and to try and comfort local residents. But I think in a case like this, where there was certain safety risks that were identified, where there were a number of people already involved through the licensing authorities, through public health, and through the police, there were enough people there. And I was totally plugged in during the course of a police board meeting to what was going on yesterday. I wasn't satisfied with it, nor were the police and everybody else involved satisfied with it. But the bottom line is, I think that for politicians to be there and trying to direct law enforcement people as to what to do, anybody who really thinks about that knows that that's not the right way to go. We have a well-established tradition here that politicians do not direct law enforcement, and law enforcement have their own discretion and their own authority to carry out with these things, and that's what's being done today and was done in the end yesterday, albeit with a start that wasn't to the satisfaction of any of us.
Follow-up question. Other businesses are now vowing to follow suit and reopen potentially tomorrow. I'm hearing of a gym and a tattoo parlor, just to name two. How do you plan to stem the tide now of these rule breakers?
Well, I think most people, the vast majority of people, understand that respect for the law is a fundamental foundation of our society, let alone of our handling of a pandemic. Respect for the law. And so the vast majority of people are complying, even at huge sacrifice to themselves, with the laws. We wish that those restrictions weren't in place. But I can tell you right now that I can only express an opinion on this, and my opinion has been very clear, that people who choose deliberately, because you don't do it by accident after all this time and after these very clear rules, people who choose to flout the law, in my book, should have the book thrown at them and should have every consequence that we can possibly muster. And again, that will be in the discretion of the law enforcement people in the end. But I think that message should be loud and clear to those people that it is not going to be countenance, it's not going to be put up with, and they shouldn't be doing it. They're showing disrespect for the law, but they're also showing disrespect for all the other people who live in the city of Toronto and for their health and well-being. It is a disgrace, quite frankly, that people would do that.
Okay, thank you. We'll go next to Dave Woodward from Global News. Dave, go ahead.
Good afternoon. Mayor Tory, you said that you weren't happy with what happened yesterday. Today, the protest at Adamson Barbecue continues. Police, they're watching, but they're not really doing a whole lot. Are you satisfied with the enforcement response today?
I'm still not entirely happy because that place, we should have found a way, and we're going to still look to find a way to have it closed at 11:01 if it was open at 11, maybe 11 o'clock and 30 seconds. But again, police have many, and other law enforcement officials have many things to take into account, including the safety of all those involved, including the people inside the restaurant and the ownership and other citizens, and they have the law to take into account as well. It's fine for me to talk about respect for the law, and I mean that most sincerely, both as a lawyer but also more importantly as mayor. And however, you have to be certain of what you can do under the law, and so I'm sure that they're taking great care to do whatever they can to make sure that people who thumb their nose at the system like this are dealt with. And the notion that a politician should go and direct that, I think if most people think about that for just 1 minute, would realize that's a bad idea. And that you have a police chief, you have a head of licensing and various others who are given these responsibilities and given discretion, and I trust them to carry out their very difficult duties, very complex duties, in the best way possible, with a view, I hope, to getting places like this shut down as quickly as possible and bringing the full weight of the law down on people who choose to act in this irresponsible manner.
My follow-up, Mayor Tory, for you. Around the time when the Ontario cannabis stores were opening in the city, Toronto enforcement officers were literally putting up concrete blocks in front of rogue cannabis stores, effectively shutting them down. Is the city considering similar treatment for Adamson Barbecue?
Again, I do not direct law enforcement, whether it be the police or whether it be the bylaw people or the public health people that go around and enforce the laws. If you ask my opinion as to whether I'd be getting those concrete blocks out of storage right now and going, if necessary, and putting those in front of Adamson's or any other place that violates the law in that manner, yes, I would. And in fact, it's even been talked about just in the context of saying that was an example of where we felt strongly that people should not be flouting the law and thumbing their nose at respect for the law in this manner, and that we should take whatever step we have to take. And so I would hope that if they're having trouble for other reasons, that's the kind of thing that they'll consider. But that's up to them. Again, I don't direct these things, and no mayors do, and no elected politicians direct the police or the bylaw enforcement people.
Thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Thanks, Brad. My first question is for Staff Superintendent Barkley, who I believe I heard is on the line. Yesterday,
yes.
Staff Superintendent, you said that there was a mistake in communication. I'm just wondering if you can clarify where exactly that communication breakdown came from that found your officers not acting on removing people from the restaurant, and can you tell me how you corrected that today, if you have?
You'll have to unmute yourself, Staff Superintendent. Just stand by for a second, Jennifer. Staff Superintendent Barkley, you'll need to unmute yourself on WebEx.
Yep.
Okay.
Can you hear me now?
We're good. We can hear you.
There we go. Thank you very much. So yesterday, as the mayor has identified, as has the other speakers, that this is a complex situation. There are elements of law that we have to make sure we are doing the right things the right way. That is why we continue to have conversations with our partners at both Toronto Public Health and Municipal Licensing and Standards, and within our own organization to make sure we give the best possible guidance to our officers that are responding to these situations. And mindful of the complexities, we have to work within the rule of law. This is a unique situation, and we evaluate it. We look at each situation in its own context, and then we assess it with our partners on what is the most appropriate actions to take. Yesterday, there was actions and decisions made in the morning, but upon review and looking at it, there was other opportunities that we could undertake. And with our partners, we continue to assess that, and the actions were taken today. The police were there, and charges were laid against the organizer.
And just to follow up for both Dr. de Villa and Carlton, I believe are also on the line. I'm hoping you can both speak to this. It is my understanding that city officials had full knowledge that this restaurant planned to open yesterday morning, and that you knew about that well in advance of the 11 a.m. opening, and yet the restaurant was allowed to open for an entire day of business. And I understand from some of my colleagues at City and elsewhere that are on the ground there today that they've actually sold out of food again and have been allowed to operate, I won't say as normal. It seems like a bit of a scene again. I'm just wondering, can you speak to what happened yesterday and whether that was up to your expectations, and why did it take an entire day even to issue the Section 22 order?
So we'll go first to Dr. de Villa, and then we'll get Carlton Grant to answer the second part. Go ahead, Doctor.
So thanks, Jen, for the question. First and foremost, we did have an inspector go out there and conduct an assessment yesterday in order to confirm that the place was in fact open and to understand and assess the situation. As you can well imagine, when it comes to enforcement, that's the first step, is to actually assess what's happening on the ground. From there, you'll be pleased to hear, I think, that due process is followed. Section 22 orders actually have to be drafted with the very specific findings based on that assessment done by the inspector. And that can't actually be done on site. It is a legal document. There is due process involved, and it actually has to be issued by either someone like myself as medical officer of health, or of course it can go to one of my associate medical officers of health who also has power under that legislation. It's not something that the inspector can simply do on their own at that moment in time on site. So in fact, what I think you saw yesterday was the due process that's built into the system, which I think we should all be satisfied is there, because it's there to protect all of us as part of the law. And I'll now turn it over to Carlton. He may have something further to add.
Go ahead, Carlton, please. Thank you.
Thanks, Brad.
Sorry, Carlton, we're having trouble hearing you. Maybe if your video's on, if you turn the video off. Sorry, Carlton, we'll have to come back to you. We're having trouble with your audio. Mr.
Can I just say, just one brief word about this? Lest anyone is under any misapprehension.
It's important
is he there now?
to know.
Sorry, Carlton, we're going to have to come back to you.
Both what Superintendent Barkley said.
This is technology during the
How's that?
Pandemic. Sorry, Carlton, we're
Try
going to
again.
have to come back to you. Your audio
We
is,
took due
is not
process.
stable.
We got.
Okay. I just want to make it very clear. I am not satisfied. We are not satisfied. But everybody is working their very best within the constraints of the laws, within the constraints of the circumstances that have a relationship to safety and other things that have to be taken into account. But we are going to make every effort. We talked about it this morning at our command table. We will talk about it every hour of every day until we make sure that we do the best we can. But people are working hard. There's no sense here that people are not paying attention to this or treating this lightly. This is a person who has gone out and deliberately flouted the law. They're showing disrespect for the people and for the law and for the health and well-being of Torontonians, and everybody's working very hard on it. And I commend the police, frankly, for the fact that they were honest enough to come forward and say that the early stages of this were not as well handled as they might be, and now we're setting about fixing it. But people should have no misapprehension that we're satisfied that it has gone as smoothly as it should, but it's better that we're figuring that out early on in this particular lockdown.
Okay, thank you. We'll go next to Kevin Connor from the Toronto Sun. Kevin?
Hi, Mr. Mayor.
Yep.
Can you explain the rules around malls and how people can go inside for storefront pickups at non-essential stores? And secondly, are there any steps in the work to end the technicalities allowing that?
Well, the policy was set out, I think, in a quite a deliberate manner to say that there were certain stores inside malls that were on the essential list. Pharmacies, there are some grocery stores located inside malls, but that the rest of the mall would be closed and the rest of the stores inside the mall would be only able to offer curbside pickup. And the thought there, as I understood it from the original provincial order, was that the malls themselves might go about setting up true curbside pickup outside of the mall, so that lots of them, not all, but lots of them especially in the inner suburbs, have a lot of curbside in areas around the parking lot to do that. So I think that was an understandable scenario that was set out for those who wish to take advantage of that. And I'm not aware really of what's happened since then in terms of, you may want to bring some specifics to my attention or to the attention of some of the officials that are on the line. Would that be Carlton again, Brad?
Yeah, Carlton, are you there? Are you able to answer that? Is your audio back?
How's that?
That's better, thank you.
Is that any better?
Yes, sir.
Okay, so I just changed my headphones. So, again, we continue to partner with public health and ourselves to ensure that malls are acting accordingly. This is something that's evolving, that people are getting used to. It is something that we are actively aware of. Some of the nuances that some people are saying that their products are for winter use or emergencies. So those are things that we are working through closely with our legal team and public health.
Thank you. Follow-up?
Yeah, so is anybody working on stopping others like handbag stores or makeup stores that are doing storefront pickup? That's places like Yorkdale and Scarborough Town Centre.
Carlton?
So curbside pickup is
Well, I apologize, everybody. We're having some technical issues with Carlton's audio feed
that it's
today.
done in a safe way. That
Sorry, Carlton. We're having trouble. We're not. We're just. Maybe if you could just reconnect for us, we'll move to the next question then, and if we can reconnect, we'll try and get that answer for you, Kevin.
Thank you, Kevin.
We'll go next to Matt Bingley from Global News.
Hi, good afternoon. Dr. de Villa, the Ontario Auditor General put out her report, and in it she characterized many issues, including which surrounding Dr. David Williams and how his exercise or lack thereof of his powers may have hindered the response for local health officials. I'm wondering if you felt that your job was made more difficult by that lack of coordination from his office, and where you see the province really pushing back today on the Auditor General's report, do you have any concerns about any of those issues that she has raised being properly addressed?
So, Matt, given that the report was just released and I was occupied this morning by some other issues, I haven't really had an opportunity to really look at the report and review any of the comments therein. I will say this, there is no question that COVID-19 has been an incredibly challenging response to effect. Managing a pandemic, with an emerging infectious disease that transmits in the way that COVID-19 does, and clearly has had this global impact, is challenging in every imaginable respect. So, I can assure you that whether we're talking about us here in local public health, our provincial counterparts, our federal counterparts, I think anyone who's been involved in any way, shape, or form in this response is incredibly sympathetic to the many challenges in mounting this kind of response. And we want to continue to work with our local partners because we're not done yet. There is still more pandemic that needs to be managed, and I think it behooves us to reflect, as always, on our lessons learned and strive to do the best we can in order to provide the best response and protect, the health of our citizens here in Toronto.
Sorry, hang on one second, Matt. We're having.
I'm sorry. I hate to ask you to repeat that question, but Kevin Connors
Matt,
was
hang on
unmuted,
one second,
so
please.
tons of feedback.
Everybody could please mute themselves if you're not speaking, because we're getting a lot of chatter in the background. We're having some technical issues here. We're unable to mute all as we're normally able to. So when you're not speaking, if you could please mute yourself, that would be very helpful. Apologies, Matt. Go ahead with your follow-up.
Well, I was actually just going to ask if you could just even repeat that answer, because the audio was unusable.
Sure. Sorry about that, Matt. We'll try. I'll try to recapture the answer again. I was talking about the many challenges that the COVID-19 pandemic has presented to all of us. So I haven't had yet the opportunity to really review the Auditor General's report. I haven't really looked at it this morning, and I will certainly look forward to having the opportunity to do that. I would just say this, that the pandemic itself has been challenging, as I said, across the board, to us at the local level, to my colleagues at the provincial level, and at the federal level, and as we've seen, to governments and public health officials all around the world. So, while I think it's important that we always review our responses and review our efforts to seek opportunities for improvement, I think that's part of good professional practice. I think that, I laud the efforts that have been put forth by people all over the world in public health and in governments all around the world, because this has been an incredibly, incredibly challenging response to effect. Please.
Just before you have your supplementary, Matt, I would just like to make a comment on that, really following along what Dr. de Villa said. I've sat in rooms with Dr. de Villa and our colleagues here where I heard things I never thought I would hear, that thousands of people in Toronto alone might die. And I'm sure that Premier Ford and his ministers sat in rooms similar to that, and we had to make decisions and muster resources and get all hands on deck as quickly as possible. Are there processes and things that should have been done differently over the years going back, or even now? For sure. Is the time to take a look at those? I mean, you learn as you go, but is the time to take a look at those after we've wrestled this pandemic to the ground? Definitely. But I want you to know the one thing that's for sure is that the cooperation that has existed between Premier Ford and his government and this government here, myself, the Medical Officer of Health, and all the others, has been excellent. We've had issues that we've had to sort out, and we've tried our best to sort them out. There have been differences of opinion, but at the end of the day, we've been trying hard to muster every available resource as quickly as possible to fight this thing and to get people sort of in good health and back to work and back to school and everything else as soon as possible, and I think that's what people expected us to do. There will be a time to look at all of this and look at it very seriously indeed, but right now I think we're focused on fighting the virus.
And to follow up, I'm just wondering, is it not right to adjust as you go rather than carry on with something that isn't working? And Dr. de Villa, I'm also just wondering if I could just sneak one quick question in there as well. You said those knowingly and negligently spreading it. Do you have clear examples of people doing that, or is this just people involved with barbecue sauce?
Matt, a couple of things. So first, to your first question, I think what you've witnessed throughout the entire COVID-19 response is our constant evolution of the response premised on our learnings. That is the fundamental basis of professional practice. It's the fundamental basis of public health practice. And, without speaking for the mayor, I would suggest to you that it is, in fact, the practice of good government to, proceed with action and adjust in accordance with what you see on the ground. Are you having the desired impact? If not, why not? And how can you change what it is that you're doing in order to achieve the desired objective? No question COVID-19 was difficult and continues to be difficult. We still have much more pandemic in front of us. However, you can rest assured that we are constantly evaluating and reevaluating our actions so as to deliver the best possible result and to provide for the best protection and promotion of the health of the residents of Toronto. So with respect to people spreading disease, certainly we know there are many examples that we have seen within our community where people have gone out and socialized with other people unknowing, not knowing that they were actually infected with COVID-19. They came into close contacts with others, and that has resulted in clusters and outbreaks in a wide variety of settings. Often, around birthday parties. We've seen it with respect to celebrations amongst colleagues at work, but at events after work. We've seen this in weddings. We've seen this in the various celebrations of life, and so that's what I was speaking of when I mentioned those in my remarks. It's those social interactions when people come into close contact with each other for a prolonged period of time, and especially when they do that without wearing a mask. These are the kinds of circumstances that we know give rise to COVID-19. That's why we're asking everybody to stay home as much as possible, to limit your interactions to the greatest extent possible, exclusively to those with whom you live. That's how we can reduce spread in our community, and that's how we can start to get back to being able to enjoy all those celebrations of life in a fashion similar to what we're accustomed to.
Okay, I think we've got Carlton Grant back on to address your question, Kevin Connor, about non-essential businesses potentially being open in malls. Carlton?
Yeah, sorry about not unmuting. Just wondering what steps, if any, or what work is done to end the technicalities that allow non-essential stores to have storefront pickup.
Go ahead,
So-
Carlton. Thank you.
Yeah, this is again something we're working through. The shopping malls is one item. The other retail stores through curbside pickup to allow it to happen in a safe way. These are things that we're working through as the new orders are coming into place and everyone's getting the full understanding of how we can make this work.
Well, thank you, Carlton. Final question is to Nicole Thompson from the Canadian Press. Go ahead, Nicole.
Hi, I have a question for both Mayor Tory and Dr. de Villa. I'm wondering if you have any response to the province's plan that they announced today in terms of celebrating the holidays, and whether you anticipate people following the advice to stick with members of your own household.
The province's Christmas advice and holiday season advice just came out shortly before we appeared in front of you today, and we haven't even had a chance to read it yet. We're going to do that. I think out of that, we've learned from previous experience with other holidays and occasions, there arise 100 questions, and I think that the public are entitled and have a great yearning for simple, consistent advice between all their different governments. And so what we'll do is we'll read it, we will talk to the provincial government about it, and try to come forward with any additional thoughts that are necessary to either clarify or just to answer some of those questions people have on a kind of a family-by-family basis. So we will get back to you on that, but we just haven't really had a chance to look at it as yet.
Okay, and just follow up, have you already started planning about enforcement of people not following that guidance, or during the holidays?
I've been asked for weeks now, were we contemplating having people going around on Christmas Eve and knocking on doors or peering down chimneys or any such thing? And I said, of course not. And I said, of course not, largely on the basis that even though I don't direct enforcement, I know as a practical matter, we don't have enough people to go around and do that, even if you thought it was a good idea. So again, I mean, we're going to have to go back to basic respect for the law, basic respect for each other, and to try and keep each other healthy, and rely on people, whatever the rules may be. When we all sort that out, the provincial government came forward with some today we'll have a look at, but whatever those rules and advice consist of, we're going to have to rely on people to go along with that, because they want this nightmare to be over as soon as possible. They want next Christmas to be a Christmas that isn't as different as this Christmas will be. And so, I'm sure there will be some enforcement activities that will be up to the enforcement people, but by and large, people are going to have to enforce this themselves, and because they think it's in their own best interest and the interest of their families and their neighbors and their co-workers and their friends to keep people healthy, which is what we've been trying to do all the way along.
Okay, thank you very much for joining us. Apologies for the technical issues this afternoon. Appreciate your patience. Please stay well.